Welcome back. Let's talk about styes. These pesky buggers can be so painful. I'll talk about how this can be managed from the medical lens, and also dive into alternative therapies. When a doctor diagnoses a stye, they'll look at your eyelid to see if it's red, swollen, and has a bump or pimple-like spot. They might ask about your symptoms and if you've had styes before. They'll make sure it's not another similar problem, like a chalazion. Usually, they can tell it's a stye by how it looks and feels. If there's any doubt, they might do more tests to be sure. A stye is a small, painful bump that can pop up on your eyelid. It happens when one of the tiny oil glands around your eyelashes gets infected by bacteria. This causes redness, swelling, and sometimes a little pimple-like spot on your eyelid. Styes can be on the outside or inside of your eyelid. They're usually not serious and often go away on their own within about a week. Remember, it's important not to try squeezing or popping a stye because it can make things worse. Triggers are usually being run down and having a depressed immune system, both of which cause reduced resistance to infection. Repeated flare-ups may be a sign of diabetes. Treating a stye is pretty straightforward. Apply a warm, moist cloth or a clean towel to the affected eyelid for 5 to 10 minutes, several times a day. This helps to soften the stye and promote drainage of the pus. Gently wash the affected eyelid with mild soap and water. Avoid rubbing or touching the stye with dirty hands. It's best to skip makeup and avoid wearing contact lenses until the stye heals to prevent further irritation. Avoid squeezing or popping the stye, as this can spread the infection or make it worse. If the stye is painful, you can take over-the-counter pain relievers like acetaminophen or ibuprofen. Styes are usually caused by the Staphylococcus aureus bacteria. Your doctor may prescribe topical antibiotic ointment or drops, or oral antibiotics if the stye is not starting to improve in 48 hours. Rarely, a surgical procedure is needed for severe progressing infections. Styes, like most inflammatory conditions, benefit from an anti-inflammatory diet that cuts out processed foods, sugar, dairy, and gluten. There are many alternative approaches to treating styes. Chinese medicine uses various Chinese herbs, acupressure, and advises cooling foods like tangerine, watermelon, and spinach, while avoiding hot foods that increase the internal heat. Naturopathic approaches include a well-balanced diet to help boost immunity and avoiding processed foods, hydrogenated vegetable oils, baked goods, and sodas. This approach also sees some supplements recommended. Benefits are questionable. Zinc is recommended at 30 to 50 milligrams per day. Beta-carotene is recommended at 25 to 50,000 international units per day. Vitamin A is recommended at 25,000 international units per day. If you are pregnant, remember to consult your doctor before taking these supplements. A naturopath may also recommend a herb compress made with eyebright, chamomile or fennel seeds, marigold or plantain leaves. These are meant to be soothing for the stye. Other compresses they may recommend is flaxseed, grated potato, or a mix of eyebright, golden seal, and raspberry leaf. It is also recommended to address the cause of stresses by getting plenty of rest, eating a healthy diet, and thereby boosting your immunity to fight infections. Homeopathic blends used to treat styes are Hepasulf, belladonna, pulsatilla, and arpus. Speak to your homeopath for more information. Herbalists advise warm, wet compresses with various herbs like calendula, eyebright, and chamomile. That's it, folks. Hope it was useful. See you again soon.